My name is Leslie. I'm the Assistant Vice President of the New York Foundlings Vincent J. Fontana Center for Child Protection and an APSAC board member. Welcome to our last workshop of the APSAC New York Foundling 8-week course on understanding child neglect and supporting families. If you've been here the whole time, thank you so much for being here with us the 8 weeks. If this is your first one, then welcome. And there will be a recording of this webinar that will be sent out following the workshop. If you have any questions, please feel free to type them in the chat and we'll try to get to anything we can by the end for a Q&A. The workshop today is titled The Bulk of CPS Neglect Cases, Racialized Poverty-Related Unintended Neglect, presented by Dr. Darcey Merritt. So I'm going to do a quick intro for Dr. Darcey Merritt, whose empirical scholarship is meaningfully informed by her vast experience as a practitioner in private and public child welfare systems. Her research centers on child maltreatment prevention, significantly neglect in parenting and socioeconomic context, considering the impact of working memory on parental decision-making. She is dedicated to elevating the voices of system-impacted parents and children in the discussion of prevention methods and service delivery in the context of systematic racism and racialized poverty. Her research has been published in the Annals of the American Academy of Political and Social Science, Race and Social Problems, Journal of Child and Family Studies, Child Welfare, Journal of Public Child Welfare, Journal of Orthopsychiatry, and the Children and Youth Services Review, which she co-edits. Her articles primarily focus on child welfare, service-impacted families, and their perceived experiences while receiving services, contextual, neighborhood, and psychosocial indicators of well-being outcomes, the structural and systematic impact of child welfare oversight on parenting, children preferences, and expectations of permanency while living out of the home placements, ways in which systematic racism manifests within child welfare systems of service delivery, and child development and well-being outcomes in the context of socio-behavioral and relational and neighborhood level factors. There's even more I can say about Dr. Merritt, but I will pass it over to her now and let her take it from here.
Thank you so much. Good afternoon, everybody. I'm really happy to be here, and I want to begin by just expressing my appreciation for having been invited to present this lecture by Leslie Brand and on behalf of APSAC, which is a critical organization very near and dear to my heart. So today I'm going to be on a little bit of a soapbox about racism within Child Protective Services system and racialized poverty related to unintended neglect. And I know that's a mouthful, and we'll get to that a little bit later. But as Leslie just highlighted, overall, my work focuses primarily on Black families and their lived experiences related to CPS oversight and poverty-related neglect. So I will get started. And of course, here's my cursor. All right, so the objectives for today's lecture, I want to make sure that we acknowledge that there's a lot of harm of embedded racism in the policies and practices of the child welfare system. I want us to understand the difference between poverty and racialized poverty in the context of maltreatment and child welfare system oversight and surveillance. And thirdly, I want to encourage us to understand the intentional practice of anti-racist and a social justice lens when we assess unintentional parental behaviors in the context of structural discrimination and causes intergenerational trauma, and there are many environmental barriers that need to be considered as well. I know saying racialized poverty-related unintentional neglect is a mouthful, and I have to be explicit in saying it that way because I need to have people know that I don't study instances of intentional physical or sexual abuse. I study neglect that is outside of the control of the parents and families based on them being parts of marginalized communities that have been structurally disenfranchised over the course of their life and intergenerationally as well. So I want to be really clear because as we move forward, I'll share some of the numbers and you'll see that the bulk of the kids that are interacting with the child welfare system are there because of neglect, oftentimes unintentional neglect by way of poverty and racialized poverty. It's really important that I point that out because I don't want people to think that I'm just presenting a presentation that speaks to not doing anything about those kids who are physically and sexually abused. Those aren't the kids that I'm focusing on, although CPS is appropriate for them. I also want to point out at the beginning that language is really important to me, and I have interviewed hundreds of birth moms that have been impacted by the child welfare system. And the reason why I'd say the term impacted is because often in the literature, you'll see that they have, we use terms such as child welfare involved or systems involved. And the parents that I've interviewed and spoken to have made it very clear to me that they would prefer not to be referred to as involved because they're not voluntarily involved. So I use the language that respects them and that honors their lived experiences. So I say things like CPS exposed or CPS impacted. And I won't go into how I have retermed child protective services. I'll spare you that. That's another lecture. Okay, so this presentation is underpinned by the conversation about the reality of racism within our systems and structures in our attempt to reimagine the child welfare system, its purpose and appropriateness to address the issues that the vast majority of CPS impacted families face. As I just said, that's neglect. The notions that racial disproportionality proliferates in systemically oppressive organizations and lower socioeconomic status cannot be disentangled with their lived experiences of racism and oppression and pervasive systems oversight. So we need to acknowledge racism as the mechanism by which racial disproportionality in child welfare services is evidenced through reporting laws and placement decisions. Later in my presentation, I'm going to include a qualitative account from one of my study respondents, who was a Black birth mom with lived experiences and the impacts of that surveillance on her and her family. So I hope you'll find the material thought-provoking and generative, and I look forward to having some questions and back and forth feedback at the end of the presentation. So we all know the United States has a very storied history of discrimination, which continues to manifest in structurally oppressive systems, including many of our social and human service agencies. Structurally racist and oppressive societal and environmental contexts are the backdrop with which all systems are underpinned. Institutional racism is often subtle, and for the most part, it's unheeded by child welfare scholars, particularly regarding Black families. So I'm suggesting the notion that inherent race-based inequities are systemically supported and perpetuated in all aspects of CWS processes. Lived experiences and perceptions of racism amidst systems involvement are directly related to being among those with lower socioeconomic status, and they result in an inability to thrive in our environment. In our society. So there's a lot of debate regarding the primary causes of racial and ethnic disproportionality and at what point in the processes this manifests. The CPS and those charged to provide services are not immune to the undercurrents of racism, and so we should all be mindful of the impact on the families that they interact with. So, as one can see, particularly if you're a member of or have proximity to my community, the Black community, on any given day or hour in any place, there are a whole bunch of reasons Black people are fearful. This is just a partial list. I've opted out of I've opted not to share the pictures of a small sample of victims because I'm personally traumatized enough. So I'm not putting up some examples of folks who have experienced these tragedies. I have a young son, a young adult son. He's not young anymore, but he's a young adult. And I had to give him the talk. I have had to give him this talk so many times. But what's disturbing is I've had to give him the talk on many forms and additional cautionary truths. How he has to navigate the world as a Black man, despite the fact that he's biracial, he identifies as a Black man, and he has to navigate the world very differently with the fears such as driving while Black, breathing while Black, running while Black, knocking on the wrong door by mistake, watching birds in the park, shopping, even sleeping in one's own bed. Living while Black is a constant, persistent fear. And I'm suggesting that parenting while Black, with regard to the likelihood of being surveilled by CPS, is a very, very scary thing. So I just want to leave you to ponder with that a little bit and think about what people are afraid of that look like people that look like me, what they're afraid of and why they have to behave differently based on these fears. So a little bit of history. What is CPS anyway? As I alluded to at the beginning, it's supposed to be called Child Protective Services. Some others have renamed it, such as Dorothy Roberts has renamed it the Family Policing System. I've renamed it Child Poverty Surveillance because pretty much the bulk of the folks that are impacted are living in poverty and with low socioeconomic status, and they're being surveilled because of the consequences of them being poor. So we started this in 1974 with the original Child Abuse Prevention and Treatment Act, otherwise known as CAPTA. And this was landmark legislation, and it established the modern child welfare system as we know it today. So while CAPTA created federal definitions of child abuse and neglect and established the grounds so that research could be funded, it also started the criminalization of families' needs rather than the creation of family supports. CAPTA focused on child abuse and neglect without challenging the larger context of discriminatory practices and the legacy of white supremacy, nor seeking to build support for children and families, regardless of race. So if child protective services are protecting children from harm, and the bulk of children are primarily served due to their low socioeconomic status, then are we saving them from the harm of poverty? So we need to continue, and do we need to continue stigmatizing and essentially blaming them from being poor? Living in poverty is unintentional, hence poverty-related neglect is unintentional. Living amongst racist systems is also unwanted, and I don't think that anybody could raise their hand and say that they would love to be poor unless you're a Buddhist monk or something and you're on a mission. I don't think that a lot of people would say they would love to be poor and love to experience racism. So that's a significant problem. Essentially, the child welfare system is suffered from a pretty significant design flaw because the way in which the services are presented and the interventions that are implemented for families who are poor is not the original intention of establishing the system in the first place. It is definitely suited, way more suited, to address those instances of intentional physical and sexual abuse. So here are some numbers. Maltreatment reports have continued to rise. However, there has been a decrease most recently in some categories. So among substantiated or indicated maltreatment allegations, American Indian or Alaska Native children have the highest rate of victimization at 15.5 per 1,000 children. Black children are substantially overrepresented with the second highest rate of victimization at 13.2 per 1,000 kids. White children are underrepresented, and their rate is 7.4 per 1,000 kids. And Latinx kids are also slightly underrepresented at a rate of 7.8 per 1,000 children. However, this varies according to region. For instance, in some places such as Texas, you see a difference. So in terms of the types of allegations that initiate CPS involvement, neglect is the highest at 76.1%, as I mentioned earlier. Those impacted by the system due to physical abuse is 16.5% and sexual abuse 9.4%. In terms of neglect, there's different types of neglect. There's a whole host of different types of neglect. Supervisory neglect is the most prevalent of the types of neglect. And that basically means kids are not supervised properly. Like in the case of many of the parents that I've interviewed, moms were reported because they left their children home because they had to go to work, and perhaps they left their toddler with a teenager, or a neighbor called and the children were left home alone. So that's the most prevalent type. And then there's physical neglect, which means a lack of basic necessities, inappropriate or unsafe housing conditions, food insecurity, things like that. So of particular concern regarding parents that are impacted by the system is the prevalence of Black moms and from low socioeconomic backgrounds. This group is substantially overrepresented, and we need to understand that if this group is substantially overrepresented, they are more likely to interface with CPS than their white peers, as the numbers present. So my work addresses this critical disparity. With 75% of the kids on any given day being deemed neglected, all due to unintentional poverty. All right. So starting from the beginning, we need to understand this neglect prevalence here, and we need to start thinking about what are we actually protecting children from? We have to go back to the etiology of the problems that present. Are we protecting them from poverty? Or are we not addressing low resource families once they've been engaged in these oversight services? So surveillance is a risk factor for child welfare involvement. And I can get into all of the mandated reporting laws, but that's again another presentation. But the bulk of the reports that are mandated by law for suspicion of maltreatment come from the professionals, legal professionals, the police, and then educators are the second most group, the group that's second most likely to make these reports because they're mandated to call in if they suspect any maltreatment. Another problem with using the term maltreatment is that we conflate child abuse and child neglect, and we need to be very specific and distinguish between what is happening with the family, what is the problem. Okay, we cannot disentangle neglect from race and poverty. It's impossible. And so we need to make sure that we give appropriate child protection when needed with physical and sexual abuse, but not necessarily the same intervention should be applied for kids who are from minoritized communities and are poor. We need to think about, are we minimizing the nature and severity and impact of neglect? Or are we minimizing the impact of structural and systemic racism, or neither? And we need to think about how formal CPS involvement has truly helped, or has it not helped? How has it harmed? And so again, just so you'll see there, I have CWS. I interchange between CPS and CWS. So many of these families function in contexts that typically and historically are oppressive structural systems related to their membership in these minority populations and living in these impoverished communities. In particular, Black and Latinx people experience many inequities inherent in systemic racism and structural oppression as they navigate all of these overlapping human service organizations, such as medical settings, educational settings, the carceral settings. One feeds into the other quite regularly. Minority impacted families are often subject to implicit biases regarding their cultural and their situational based parenting behaviors. For instance, Black youths are more likely to be deemed in need of services despite their white counterparts exhibiting comparable presenting situations. Okay, so given these factors haven't yet been disentangled from specific decision-making points in terms of the disproportionality, it's vital to validate the experiences of oppression and discrimination and racism. There's so much literature that can document the prevalence of the rates and which kids are more disproportionately represented in the system than others, say at reporting, or maybe at adjudication, or with regard to placement decisions. So we need to just really sit with the fact that we don't know enough. I'm trying to gather this information. We don't know enough about how this actually impacts family dynamics in the home, how it impacts the ways in which moms navigate the world differently because they're always fearful of this surveillance. And believe me, they navigate the world very, very differently because they know at any given moment, somebody can come knocking on the door, tell them that they're not parenting correctly, and threaten them with having their children removed. So this is constant trauma that they're experiencing. And there's very little ways to escape these practices and displayed by these people that have power and authority to totally separate and disrupt families. There's near constant oversight and inspection, wherein parental behaviors are regularly questioned, and parents are well aware of this from the moment they get their very first investigation. So I posit the notion that the very minute a report is made, a judgment has been made, and more often than not, we ignore the implicit biases in these assessments. And the systems-based approach is accusatory in nature and based on possibly misunderstood parenting practices, despite parents' good intentions. As authorities, practitioners, we tend to judge parenting based on our own Western world, oftentimes white privileged lens and the ways in which we think parents should be behaving, but we're not thinking about the context in which parents are living and how they might be making a decision that's actually protective, but we might deem it as neglectful. So I'll give you a quick example. A couple of my parents have told me that they've had to teach their children to behave very differently, kind of with a harder demeanor when they're out in the community because they need to be able to protect themselves if they're in a negative environment or neighborhood. But caseworkers have pushed back and said you should not be training your child to behave this way, but the parents are being protective because they know the environments that they live in. And it's really important that we pay attention to this. Okay, so the intersection of populations of color and those with low socioeconomic status results in the system's over surveillance and these biased judgments regarding child maltreatment risk. I'll mention here also, if you are familiar with the literature, most of the literature focuses on risk factors. So there's a deficit-based lens that we're approaching even the research that we conduct. We're not looking for strengths, and there are many strengths that poor Black families have, but we're really focusing on the risk factors, and generally they're at the individual micro level, and they rely on identifying parental deficiencies and pathologizing parents. So this intersection particularly plays a role when we think about racialized poverty in the United States, because it's specifically associated with Black African-American families that are involuntarily living in poverty and suffering from systemic oppression across the board based on the skin they live in. It's critical to acknowledge that experiences with poverty are intensified by structural racism in practice, and that's why we term it racialized poverty. This is inclusive of the mandated reportings laws from school professionals and others that I highlighted a minute ago. So there's really a dearth of scholarship examining CPS surveillance of Black families, considering the historical oppression and their experiences of racialized poverty. As racialized poverty shapes negative perceptions of these historically disenfranchised populations, seeking and in need of just some equitable supports that are mindful of their marginalized contexts and various identities. These perceptions are embedded in the institutional procedures and policies of bodies responsible for protecting kids, and they inform the actualization and processes of these surveillance and these interventions that we place upon people. So poverty, particularly extreme poverty, is a form of trauma. That's a fact. And it results in a host of deleterious outcomes, such as poor functioning, suboptimal behavioral choices. Risk factors that result in increased CPS oversight are generally outside the control of parents, primarily due to their positionality in society. So sadly, this is what results in a much higher likelihood of initial CPS oversight and surveillance. There's tons of research that documents the relationship between poverty and maltreatment, but less so considering racialized poverty. So again, neglect cannot be disentangled from race and poverty. So appropriate child protection from physical or sexual abuse requires a different approach for protection from racialized poverty and the accompanied consequences. When we talk about minimally adequate care, we must immediately consider one's financial well-being. And the CPS was just not designed to address poverty. It's supposed to be an intervention to address harm from abuse, which has been totally conflated with unintentional neglect. So under what context are adequate care evaluated? A few of my study respondents have reported accounts about their needs not being met unless there was CPS involvement. So let's consider the primary goals of CPS. And that's pretty sad that we have societal ills and harms that are happening outside of the control of these parents. And we're not addressing them as a country at all. With our federal policies or state or local policies, we're not addressing all of those outside forces that keep parents in poverty. And then the poverty results in neglectful behaviors because there's no other choice. But we're not addressing that. We're kind of like putting the wrong Band-Aid on the wrong sore, because we're just, as a society, unwilling to look at all of the ways in which we are continue to disenfranchise certain people based on what they look like and the history of how they've been treated in this country. Okay, so I want us to be clear. We use these, and we have so many buzzwords, and we need to just be really clear about the meanings of these buzzwords. We talk about equities, we talk about equality. There's a clear difference between inequality and inequity. So histories and context matter. So there, I've got a little chart there that just kind of gives you a visual of what the differences are. You've got justice, you've got equity, equality, and inequality. I also note that to my knowledge, unless something has changed, the CDC has not previously considered intentionality of parental behaviors. So based on historical and structural inequities, our most marginalized populations are not benefiting from any of the protections based on their identities. So CDC is not considering whether or not a parent just said, I don't think I'm going to feed that child today. I just don't want to feed the child. They're not considering the fact that they don't have money to get the food for the child, or they don't have money to hire a nanny to come in and watch the baby if they get called in for an extra shift in order to pay their rent. And so these are very hard decisions that parents have to get through and navigate so that they can avoid this surveillance. So the social inequities, that's the problem. That's the problem. That's why we have 75% of the impacted kids due to racialized poverty-related neglect. So experiencing poverty and racism, again, unintentional, and the consequences shouldn't be blamed on parents. We blame parents that are trying to raise their kids to the best of their abilities and resources. Parents' behavioral intentions should be considered as a function of their available resources and histories with structural discrimination in environmental contexts. So perhaps we would be able to designate far fewer kids as neglected, and the assumption is that they're intentionally neglected because the CDC doesn't make that distinction, instead of, and then avoid subjecting them to such stigmatizing CPS oversight, because it is very stigmatizing and that can't be overcome either. Parental behaviors related to poverty and oppression should not be deemed maltreatment, in my opinion, because again, it's this unintentionality factor. Severe policy revisions are absolutely needed that mandate a non-judgmental approach from the beginning and throughout the whole course of CPS exposure. Parents feel stigmatized, they feel disrespected, they feel like they have a lack of voice because they can't say anything, because the processes that are codified and at play are inherently coercive. Authorities with power are telling parents with no power, you must do this or that, or we can take your child from your home. And Black families there's been a history of separating Black families since we were trafficked here. And during slavery times, it's been going on forever. And we just aren't thinking deeply about what that means. What does it say about us as a society? So I'm sharing this quote because I find it to be really crystal clear and also incredibly disturbing. If you came with no preconceptions about the purpose of the child welfare system, would you have to conclude that it is an institution designed to monitor, regulate, and punish poor families of color? That's what's happening. So again, just to punctuate, consider the original mission of CPS as outlined by CAPTA and the etiology of the harms that result in CPS exposure. We have lost track of a comprehensible, nuanced logic model that considers the context people live in and the short-sighted interventions in place to address the challenges facing the bulk of these families. So I say racism is the mechanism by which CPS, racial disproportionality, thrives. We have been and will continue to unpack this for years to come, but we really need to add historical and structural systemic racism as a primary variable. And the problem with this is we don't have any good valid measures of racism. Okay, people control for race all the time, and I can opine about how inappropriate that is under certain circumstances, but we're not measuring racism. And so when I do my qualitative research, I try to understand how racism plays out in the lived experiences of these families. But the qualitative, there's a debate about whether or not, that information is valid and generalizable and all of these things. We need to consider racism as the driver of concentrated poverty. Then we get racial disproportionality. So I put forth these two pathways for consideration with an emphasis on the first societal ill, which is racism. And so I've inserted neglect to remind us that over 3/4 of the maltreated children are neglected, alone without co-occurrence. So neglect is directly related to economic hardship. So, so I was a practitioner before I was a researcher. I was a practitioner for over a couple of decades. And what I try to, I teach a lot of clinicians as well. And so because the system is set up to inherently blame parents for not doing it right and for circumstances outside of their control, when I ask my students how they approach the parents, if they're going to go speak with some parents, I always encourage them to, the first question should be, what happened to you? That should be the guiding question, not what did you do, what's wrong, just simply what happened to you, because that way you're respecting them enough to acknowledge that there's something outside of themselves that happened to them, or a series of things that happened to them that ended up placing them in the position that they're in now. So I'm going to share this. This is an account from one of my birth moms that I interviewed for one of my studies. I've renamed her Amy. And so what happened was she had a 9-year-old little boy and he kept missing school. He was consistently truant from school, and mom was having a really, really hard time taking care of the home and providing for the children. What happened before this, the catalyst was that mom was sexually assaulted and raped while walking along a path that was on the way towards her son's school. She was suffering from extreme emotional trauma, struggling to care for her children. She did the right thing. She was going to the doctor because she had mental and physical ills and harms that happened to her due to the rape, obviously. And she was trying to get help from therapists and her primary doctor, and she was letting the school know what was going on. And because they're mandated reporters, instead of helping mom and understanding, they made a report. So what happened was her kids were taken. This rape had occurred 2 blocks from her son's school, and she was triggered. She couldn't walk him past the trauma scene to the school. So the depression was debilitating and paralyzed her from taking care of the rest of the kids in the home and everything. And she did what she thought. She said in another point, she said, help is scary. That was a quote from her, because she went for help and she got reported. And the outcome was she lost her kids and didn't get them back for 5 years. That's unacceptable. That shouldn't happen. And there's countless cases, heartbreaking cases of similar harms that I've unfortunately learned from these moms. So this was a failed intervention. So in the study that I did, I asked them a series of questions because what I'm trying to do is understand how their working memory of CPS involvement, being surveilled, all the oversight, the people knocking at the door, teachers saying things, how these experiences seep into their working memory and then impact their future decisions about parenting. So it's a elicitation analysis. It's kind of complicated. To do how I'm doing the analysis. So I'm just going to go over some of the questions that I had to ask in order to complete these analyses. And so one of the questions was we presented the mom with a vignette, and we asked them to think about the situation that landed them under the purview of the system in the first place, and the vignette, and discuss what disadvantages or problems that they saw with regard to the decisions that they made. So this mom, still Amy, she says, I kind of put myself at a disadvantage, which I know might sound crazy, but I was seeking help. The mental help I was seeking and the physical help that I was seeking from my doctors, trying to be honest with my doctors about what was going on. I opened my whole world up for that, like just that extra layer of surveillance. She says there's a lot of stigma surrounding mental health in the community that she grew up in, which is well known in the Black community and other cultures as well. So, I thought I was doing the right thing, but I do believe I put myself at a disadvantage because it took me so long to get my kids back. It took me almost 5 years to get my children back. So this is an account of her experience and trying to get help. So we also ask a question, why do the certain people, we ask them who would approve or disapprove of their decision, because we're trying to figure out who is the support system, who is giving them validation for the choices that they were making. And so we ask, why do these people come to mind? And Amy here says, the doctor comes to mind because she went for help and she was honest, and that didn't work out for her. She was honest about her mental struggle. And she says, it was hard at the time for me to take care of the children because whatever I was going through, I was struggling to meet all their needs, struggling instead of helping. I was, punished. I was punished because he was a mandated reporter. They didn't recognize the trauma. And the same goes for the teachers that struggled with, truancy, as far as my eldest child not making it to school, but never offering an alternative. She says they come to mind because every place that we turned, every place that a person such as I can turn to in the city for help can also be that place that hurts us the most. Because every professional, anybody that's connected in a professional realm is a mandated reporter. Everybody is that nail to the hammer everywhere you go. So you struggle. You struggle to ask for help because help is scary. We also ask parents, what feelings or emotions did you have at the time? And fear was a huge, huge theme. So fear of losing my children, pure terror when I lost them. Fear at every turn, every walkthrough, every room they had to inspect, every refrigerator they had to open, toilet they had to flush, just fear and shame because I got to the point that I couldn't provide for my children properly. I always had guilt that I lost my children, anger, anger at the fact that I lost that this was done to me, and I didn't feel as though it was any of my fault, but she was paying the biggest price. There's so many other stories such as this. There was a story, I don't have a slide for it, but I'll just share one of off the top of my head some other stories. A mom was pregnant and poor and didn't have enough money for food, and so she was giving blood. She was donating her blood in order to be able to pay for food for her family. And the caseworker did not believe her and thought that she was doing drugs. And so that opened up a whole door of surveillance for her. There was another family that was in a domestic violence situation, which is, of course, is very, very prevalent. Most of the cases that come that the people that I've interviewed, it was due to supervisory neglect. A lot of domestic violence was going on. So she was in a shelter because shelter for people, survivors of domestic violence, a building. And she was in her room up, and I guess on a higher floor, and she had ordered food for the children. And she left the children in the building like an apartment, and she went downstairs to collect the food from the delivery person. And the shelter staff called CPS on her because she left her children just to go downstairs and get the food in the shelter. There's so many stories that are just painful, painful. I'm gonna let you sit with that, but I have this slide here because I want to point out that I study moms because moms generally bear the brunt of the oversight and the onus of having to raise the kids. And we forget about dads a lot, but dads count as well. And poor Black and brown moms love their children. There are many strengths that these families have. There are many strategies that they implement in order to survive and be resilient. We won't get into why a family would need to be resilient over another type of family, but I want to point out that there are very strong, loving, healthy families, even living in racialized poverty-related conditions. And it's very important that we pay attention to that and not just look for risk factors and pathologize parents and say, well, you've got this substance abuse issue. And regarding substance abuse, that's another very prevalent entryway to CPS involvement and being exposed to CPS and surveilled. But wonder if we can consider the notion of parenting while struggling with sobriety. I realize it's hard to do. Or I can imagine it is, but why can't we figure out a way to preserve families while parents are struggling with sobriety? Because we know substance abuse is a disease. So why are we punishing parents for having a disease instead of helping them to function better under those conditions in the midst of their struggles with sobriety? So I want to end with these parting words of caution. Um, at this urgent moment, and I think it's urgent because on any given day, there are parents that are experiencing stories such as I just highlighted. I think we would be remiss if we just didn't pause and really reflect and figure out how we can course correct the situation. So again, starting with asking parents, what happened to you as the guiding question, to acknowledge that this is not their fault. This is a societal ill and something went wrong, and we need to not punish them when something went wrong that happened to them. And we need to consider, what is our end goal? What is our mission? Is it what we set out to have it be back in the early 70s with CAPTA, when we were trying to protect kids from physical and sexual abuse, and all of a sudden we had the bulk of the children, because of the mandated reporting laws, included neglect, and then there were all kinds of consequences if people weren't making these reports. And throw in some implicit bias and maybe some explicit systemic racism, and here we are now. The take-home message is, I think it's overdue time that we need to digest. It's an undisputable fact that racism is alive and operating well within all of our human service organizations, particularly the child welfare system. It's not immune. And the child welfare system is very much connected to the carceral system as well. If the history of this country was racism, then all systems, all organizations and processes and practices are tethered to those foundational designs to address societal problems. Parents have very little reason to trust systems, certain types of parents and authority figures, when they're threatened with family disruption and their move over their kids on a constant basis. They have an acute awareness of negative assumptions about them based on their positionality, their race in society, and it's bolstered by this ongoing and increasingly outward discrimination. So I would encourage everybody to just let your North Stars guide you, and ask yourself, what are we doing? Are we saving children of color from poverty? Are we blaming parents of color for being poor? So what's next? What do we do next? Because that's always the question. So how do we fix it? There's a whole debate about, do we abolish the system? Do we reimagine the system? And there are valid reasons for all of those considerations to be thought about. What I think we need to do is, we need to first understand that these parents are enduring this because of situations outside of their control. We need to understand that they're put in a position of being consistently fearful and doubting the systems that are claiming to support them. So I think that we need a reputable system of support that's based on individual family needs in the context of this collective oppression and systemic racism that they endure. People of color should not just be considered just an issue with the intent to pathologize their individual behaviors, but rather we need to focus on the connections between the community. There's community mutual oppression, and how the systems benefit and maintain based on these traumatic experiences that they're having. People are saying, well, we should, instead of mandated reporting, maybe we should move to mandated supporting, and others say, well, mandated, we don't want to use the word mandated at all. So we will be debating this for a while, but I'll tell you one thing. There is so much stigma with CPS services and interventions that I actually do not think that we can have a system suited to address racialized poverty-related unintentional neglect that has anything to do with CPS, because that's not what CPS was designed to do in the first place. And I don't think that we can erase the stigma and just put a window dressing on it. I think we need a separate set of structures or strategies or tactics to address the societal harms and ills that land families in these positions, separate from a system such as CPS that is absolutely suited to address physical abuse and sexual abuse. So I want to say thank you. And also, I always have to give my most respect and appreciation to moms that look like me, that entrusted me with their stories of trauma and resilience. It's very hard for them to get through life. They navigate the world very differently. They have to document everything. They keep receipts. They've developed an institutionalized language, sadly, and they say things like, "I don't want to catch a case again," if some of you have heard that used in carceral contexts. So behaviors are definitely impacted by how the surveillance has affected this entire community. So that's all for my presentation.
Thank you so much, Darcey. We actually have about 45 minutes left, so if you have anything else, we have some questions coming through.
Yeah, I went too fast.
No, not a problem. It's more time for questions now. But if there's anything else, feel free to let people know. But right now we have Jeffrey raising his hand. So if you have any questions, if you want to unmute yourself, Jeffrey, feel free to ask.
Well, this was a wonderful presentation and very explicit. I want to tell Dr. Merritt that I come at this from a totally different perspective. My responsibility in California is to deal with what are called critical incidents, which are child murders due to abuse and neglect. And from a public health epidemiological perspective, this is outside the population you just described. It involves, number one, infants less than a year old. More than half of all decedents due to abuse and neglect are less than a year old.
Are you there?
Yes. Number two,
Okay.
it's very heavily related to substance use disorder, mental illness in the guardians or parents, and domestic violence. And so we're not talking, when we talk about intentionality, I think there has to be a system. Again, substance use and maybe domestic violence are also racially and poverty predisposed. Poverty predisposed. But still in all, these guardian characteristics put children at risk, and I come across it when they die. So I think your paradigm needs to be expanded, and one should recognize that substance use disorder, mental illness, and domestic violence in the parents comes under the rubric of general neglect. So it needs to be separated out as real risky to children, and child protection has to come first.
I understand that, and that's really, I mean, that's a tough work you do. It's very unfortunate and sad and devastating, and I understand that, and I agree with you. It needs to be expanded. I think we should separate the specific issues that parents are dealing with and make sure we're applying the appropriate intervention or service or supports for that issue. I absolutely agree with you. So again, I talk about intentionality because, again, the people that I care about and study are the people that, by no intention at all or by no fault of their own, come into the surveillance of CPS. But yeah, we need to figure out the right ways. We need mental health services to be bolstered and made available and accessible to people. And we need substance abuse behavioral health issues to be dealt with as well. I just don't think that it should fall under the current CPS system as we know it now. And I also, to your last point about child protection has to come first, I agree with you. Another thing that I'm just concerned with, though, is that we tend to separate children from their parents, and children live in families. So at the same time that we're giving support to the children and making sure they're protected, we should be supporting the parents so that they can parent better, so that they can parent well, instead of separating them out and thus pitting the parents against their children in certain circumstances. Thank you for your question.
Thank you so much. We do have a few more questions in the chat. One of the questions that came through was, what would working with substance using parents look like to ensure children are safe and receive adequate environmental stimulation? some sessions talked about how damaging that is on young children in particular.
Yeah, it's really tricky because we need to, I mean, we have to get better services for people and not only just have the services. There's a problem with accessibility and availability of services for certain people. And we need to make sure that I think that there need to be more community supports, to be honest with you, and less stigmatizing supports and services for folks. So that's what I imagine, a separate system, if you will, and I don't like the word system, but a separate system to specifically deal with substance abuse issues, because typically those issues are due to other things that are happening, right? And so whether it's mental health challenges or whether it's some other trauma or problem that's happening with the individual. So I think we need to really figure out how to parse out what that parent needs as a immediate, most salient risk. If I had all the answers, everybody, I wouldn't be here.
Very true. Thank you. So somebody else put a question in the chat. They said, a lot of questions are coming through, so you're going to have plenty of questions for today. One question that came through was, this person said, I am wondering if you talked to the children of your moms. What was their feelings, impression about their CPS experience?
I would have loved to talk to the children, but that would have been an IRB nightmare.
I was
So,
thinking that. I was like, I
yeah.
don't know if that's actually quite sad though, because we never really hear from the children's experiences because of the red tape.
Yeah, they're too vulnerable of a population.
Yeah.
Yeah. But I get accounts from the children from their parents.
And just I used to work directly with kids in schools, teaching them like about prevention. And a lot of the kids did express a lot of fear when it comes to social services.
Yeah.
Just not even provoked, just raising their hand, expressing fear. So that is not research based. That is just observational.
Another thing, Leslie, is like what I've also heard, another, poor outcome of these services and intervention is that it creates a horrible dynamic with moms and dads and their kids, because at least those kids that are older, they know, imagine you're at home and you've got your parents, but you've had constant oversight by these authorities that have said, we can take you away. And so the kids are oftentimes weaponized. And so if you just have like a wacko teenager that wants to go to the party and he starts threatening to call CPS on mom because mom won't let him go to the party, like it's problematic. Like who's raising the family in the kids' minds?
Exactly. That sounds extremely confusing for a child. Another question that came through is, in addition to giving the families money, what programs are working to help the children who have been harmed due to poverty?
Well, we need to do, so I'm doing a little bit of work, a little bit of consulting work, and I'm trying to help figure out exactly that, what steps to do. And so we need agencies that can help parents. Like if a mom can't afford childcare, some agency needs to pay for it. If a mom can't afford transportation to the substance abuse treatment, somebody needs to get somebody in there to babysit those children so she can go and help her get and scheduling around her work schedule. We need to put all hands on deck to eliminate the barriers that parents face in trying to get treatment and help that would avoid neglectful behavior or abusive behavior.
Exactly. Somebody wrote a question, kind of jumping off of what Jeffrey stated. They said, similar to what Jeffrey stated, a previous session noted a study, I think it was, what does Child Protective Services investigate as neglect? The study claimed 99% of physical neglect investigations involved significant underlying issues related to substance abuse, DV, mental illness. What are your thoughts? What thoughts do you have on that? Are there other studies that indicate physical neglect is often not related to these issues?
I'm sure there are. I can't think of any off the top of my head, but I don't know what that study is that the person is citing, but we would have to know what variables were put in there to be assessed, right? Because there's a lot of overlap. Like we have kids that are being physically abused, which basically means they don't have they're being physically abused. And so that could be substance abuse, that could be mental health issues. There's a lot of overlap. And it really, the most prevalent form of maltreatment is what gets marked as the presenting issue to be dealt with. But that doesn't mean that other things aren't happening at the same time. And so it depends on how these studies are crafted. I hope that helps.
Yeah, I think so. And I'm like, we've had so many sessions. I'm trying to think of the exact study they're referencing, but it is not coming to me now. So if I find it, I'll get some information on that. Somebody else asked, I'm wondering if you that one, how do you get parents to use the services without CPS powers to encourage their participation? It's very interesting.
It is interesting because that's quite the euphemism. Powers to encourage.
And they put little quotations on.
Oh, okay. I'm not
encourage.
looking at the chat, so okay.
No,
Okay,
sorry, I should have done the quotes with it. They put the powers to encourage.
I like
And
that. That's very soft and lovely. Yeah, the powers to encourage. I mean, the coerciveness. You don't have CPS as the suggesting group to say suggest this. I don't know, like, again, everybody's a mandated reporter. So we need to have some entity separate, some group of people, practitioners, clinicians, separate from CPS to offer supportive help and make that encouragement and do that. Therapists. Yeah. And so if we don't have these mandates, if we don't have CPS already involved, see, once CPS is involved, it's over. It's over because then you have mandates. Then you have to do this and you have to do that. So ideally, in a happy world, we would have other systems, other groups of people that were supporting parents in such, whatever they're plagued with before CPS even gets involved. Then we don't have that coercive shtick.
And it also might help sometimes, I know, to ask the families what they would like, exactly how they would like it. So they can be part of the decision
In the
making.
beginning.
When people are involved in the planning, they're more likely to attend, and they're more likely to take the services. When you ask them, a lot of times people don't think to ask the parents anything.
Yeah.
So.
Yeah, that's the current research I'm doing now. One of my projects is I'm doing a survey. I'm trying to design a survey to understand what parents know about their rights, family rights, because they do have rights, like when somebody comes knocking on the door, or what their children should know when the teacher pulls them out of a room and starts to strip them down and look for bruises and things like that. They need to know their rights. I also want to develop a well-being survey, because we don't really do well-being survey from a strength-based perspective of the parents. So that's the current work I'm doing now, involving them at the front end. What would be helpful? What does this look like? To answer the exact question that you just asked, Leslie, like what would encourage you to go and get help for this or that?
Exactly. That's very interesting. I'm interested to see what the results are of that.
Yeah, we're working on it.
Because I've always thought that. I'm always just like, what? I always want to get to the people who like get right to the people. Because I feel like we do make, as professionals, we kind of make decisions
Yeah.
for people a lot without actually consulting the people who are going to be impacted by the decisions. So
I no longer do any work without including people with lived experiences from step one.
Amazing. I completely agree.
Yeah.
Another question that came through the chat is the Federal Family First Initiative helpful for dealing with these families?
It can be, depends. It can be. I mean, the redirection of funds, the push towards family preservation, making sure that the placements are appropriate for the kids. So it can be. I think it's like we're going to be, that's, a few years out. So fairly new. Oh, what's
Can
that?
somebody share their screen? I'm not a host anymore, so if you can, Christy, if you can unshare their screen. Thank you. It happens.
I'm like, charge.
Technology. I believe somebody did put the paper we were referring to earlier in the chat. So
Oh, great. I'll read it.
perfect. And I do not think we have any questions. We have an interesting comment from earlier that I thought would be great to go through. And if anybody has any final questions or they
Oh,
want to
yeah,
unmute
I know that
themselves,
paper. I know that paper. I don't want to, let's not, go. I know
you
that
don't want to
paper.
go there in the paper. I was going
Nope,
to say thoughts
nope.
on the paper, but we do
Yeah, we're
not
not going there.
have thoughts on it.
Yeah, I take exception with some things in that paper. So,
Interesting.
okay.
That's the one thing to take about research is you should always read all aspects of a topic to get all the sides.
Absolutely.
Somebody earlier had a comment that kind of was dealing with something you said earlier. They said they had almost the exact same situation happen to a parent in her study. She stepped out of the room in an NYC shelter to defend herself against another resident who had knocked on her door, taunting and harassing her. So she left the kids in the unit during the fight, and the shelter called CPS on her, citing neglect for lack of supervision.
Mm-hmm.
So, yeah, these things happen frequently.
Mm-hmm. And the shelter is supposed to be the helpful, safe place, right? And people need to understand, like, just what urges us, just internally, what urges us to make such quick judgments and call authorities without understanding what the issue is. I mean, I'm sure that if I was I've been in another country and I left my kid in the hotel, of course, with the people knowing that I was going to be doing that. And I went off to dinner and came back and he was fine. Of course, he was like 12 years old, but still, they could have called the CPS on me easily. Easily.
Oh yeah, I have lots of memories as a child of being like 12 or 13 and babysitting other people's children, but I had the advantage of being in a middle class area in the suburbs and being a white person that nobody ever thought to call CPS on any of these families. So
Yeah, and 13, I believe, is a legal age to be able to look at to babysit. It might be different in different jurisdictions, but yeah, still, once the call gets made, the ball is rolling. And so poor minoritized communities are oftentimes in settings and communities and systems and neighborhoods where there is already a lot of oversight by police or, other human service organizations that are supposed to be supportive and helpful to families. And so they're more likely to be in those settings that are more surveilled. And so that's why more calls are likely to come in as well. But if you're kind of isolated, I grew up in a very privileged, isolated place as well. So I wasn't put in the position where somebody was going to tell my parent, you're not doing it right. Because my parents weren't going to seek help from these oversight systems.
yeah. And I just couldn't imagine the fear that why would a family go to seek help if they think that they might get in trouble? So the idea of like, well, you should have asked for help. Well, it's like I'm scared, so it's a real problem. Somebody else in the chat said in Virginia, we have an assessment track in CPS that most of these families are put into, which seems to deal with some of these families quite well, others not so well. It is designed this way because of funding issues. How can that be changed?
We need to change the funding issues. So always follow the money. Always follow the money. So Title IV money, the federal government gives the bulk of the money that they give to the states for such services is slated for out-of-home placement. So therefore, the incentive is to place children out of home. So if we put more money into preventive work to support people in issues related to poverty or substance abuse challenges or mental health challenges, then that's will be our intention. That's what we would pay attention to, and that's what we will want to correct. But if you're receiving monies and you are mandated to like split it up and spend the bulk of it on an intervention called foster placement, then that's what the incentives are, and that's how it plays out in practice as well. And I said placement instead of care because, again, parents have told me oftentimes they don't feel like their children they don't like the word care for them being out of home. It's a placement, it's an intervention, not necessarily care, although the caregivers are caregiving, It's just the nuances of the language that we need to be careful about.
Definitely agree. Yeah, money
That
will always
question.
help. Yeah, another question that came through is the CPS system's work with Black families has had some worse outcomes, such as Black children being in care significantly longer. How should Black families be worked with differently?
Well, that's exactly the type of work I'm looking into, or I'm trying to tease out with this consultation work that I'm doing. Yeah, they are left, studies show that they are left to linger in care far longer than other children. And so we need to, that's when we need to think about family court systems. The judges and the attorneys in the family courts need to understand all of this, and they need to understand what happened in the beginning to families and take that into consideration as they're making decisions to place and or terminate parental rights or decide how long a child needs to stay there. So we need to be mindful that Black children are absolutely treated differently. Okay. And that's because of the implicit biases that we have and how those systemic biases are baked into the policies and the rules and regulations. That's what I
Exactly.
would say.
Yeah. And besides just educating yourself, like how to or educating workers, like how do you get rid of these implicit biases?
Mhm.
And a lot of people don't.
Everybody has biases. I mean, everybody has biases. The problem is we are not constantly ever mindful of them. So we need
Mhm.
to be constantly personally responsible to be mindful. Like put yourself, I mean, why do we not have empathy, like basic empathy? And the capacity to imagine being in a similar situation and how would you feel to be treated if you were in a similar situation?
Yeah. No, it seems like it would be an easy thing to do, but it's really not. Um, so thank you everybody for your questions today. I don't see any others coming through. I want to make sure we didn't forget anybody. But I'm happy to let everybody have, everybody can go enjoy the rest of their day. Oh, we do have another question that came through, so we do have some time for that. Somebody said, are there any parental programs that work well with these families? Anything you
Um,
can suggest?
yeah, there are a few. I do another for the what where do I go? Leslie, in the fall, I do the Hertz lecture,
Yeah,
and I highlight some of the best practices in terms of parental programs. At first, I was like, okay, prenatal. I'm like, I don't know about that, but I can go on and opine about prenatal. Oh, she is saying prenatal, right?
that was one of the suggestions in the chat was prenatal. Yep.
Okay, prenatal. This is not parental. Yeah, there's lots of like services and programs that have been at home visiting programs for parents that are pregnant that can help them prepare to parent well. So there's a whole clearinghouse where one can find some positive services and treatments and interventions that have been implemented. But again, that clearinghouse is generally full of services and interventions that have been rigorously studied with like the gold standard RCTs, and a lot of programs don't have funding to have those studies conducted. So we might be missing a lot of really positive interventions that just aren't studied well enough to have made the clearinghouse of choices. Healthy families, doulas, yeah.
Yeah. Somebody else asked, they just asked, what is the best way to reach you? I would like to ask some more research methods questions as I am working on a dissertation study with Black impacted parents in New York City.
Fantastic. You could just email me.
Do you
Uh,
want me to stick the email in your email in the
Sure.
chat or?
Sure,
Okay.
yeah, that's fine. It's totally fine. I'd be happy to talk about that because I started off studying Black impacted parents in New York City, and I expanded it out to the nation. So I'm quite familiar with a lot of the agencies serving these parents in New York City. Even though I'm a professor at U Chicago, I was at NYU for 12 years. So
But I'm putting your email in the chat. It's I'm just putting your Gmail. Is that okay? Or is there another email you prefer?
Thank you, Ashley. Everything goes to the Gmail, even my Chicago, everything goes to the Gmail.
Okay, perfect.
And sadly, I'm Googleable.
So your email is now in the chat if anybody wants to reach out to you directly. And also Dr. Merritt does an excellent presentation for his program every year that the Foundling does. It's a 15-week course in the fall, and it's free for all Foundling staff and ABSAC members. So that will go out. You'll get, it's not officially, we don't have a brochure for it yet, but as soon as we do, all ABSAC will send an email out, and so will the Foundling. So you should be seeing that soon. Thank you so much, Dr. Merritt, and thank you everybody for being here today and being here for the entire course. And I look forward to seeing you for future courses.
Yeah.
Thank you
I'm
so
really
much.
happy to have been here. Thank you, everybody. And remember, ask folks what happened to them.
Absolutely. And I can't wait to see your upcoming research and your studies, Dr. Merritt, as well, because it's very interesting. So thank you all for being here, and I look forward to seeing you soon.
All right. See you in New Orleans.
See you in New Orleans. And everybody come to the ABSAC colloquium in New Orleans. There was something in the chat about it earlier, but please, everybody sign up and get your rooms because they're booking up. So we hope to see all of you. Somebody's asking, when is the colloquium? I think the dates are the June 9th through the 13th.
Yes, that's correct.
Perfect. Yep. So please, yes, come to the colloquium and we'll see you there. Bye, everyone.
Bye.